The last topic that we kind of want to touch on today is the things that you can do to continue to protect yourself. And again, we've reviewed this in previous videos, obviously socially distancing, frequent hand washing. We've talked about, when you're in public, the precautions you should be taking. But today specifically, we want to talk about masks and actually eye protection. There's a lot of kind of opinion out there that some of this may actually be transmitted from person to person via droplets that fall in the eye. So anytime you guys are in public, whether it's at the supermarket or anywhere that you're going to be in a closed environment, and that means an air-conditioned closed environment, you should consider some kind of eye protection, and that can be just a simple pair of clear glasses or goggles. Specifically when it comes to masks, you guys will see a lot of stuff out there about which mask you should buy and which ones are effective. The bottom line is that a lot of the reason why we encourage people to wear masks isn't so much to protect you from getting the virus, it's more for protecting the people around you from you giving them the virus should you have it. We know that if two people have just regular surgical masks, facial coverings, and both of them are wearing it, it's very, very unlikely that you will have transmission of virus. As little as 1.5% of those patients will actually transmit virus to each other. However, that's with a regular surgical mask or just a cloth facial covering. If your goal and your intent is really to prevent yourself from getting the virus from somebody else, in addition to the eye protection that I mentioned, you really should be wearing either a N95 mask, which is similar to what I'm wearing right now, or a KN95 mask, which is what Gary is wearing. You guys will notice that the KN95s are much easier to get your hands on. And the reason why is that the N95 masks, which have the really tight straps, are really being kind of steered towards the healthcare industry. And so if you can find them out there, you're going to pay a much more expensive price for them, typically in the range of about $4 to $5 a mask. But obviously, because they give you such a tight seal around your nose and your mouth, they protect you significantly more than a KN95 mask, which basically just loops around the ears. The KN95, however, does adhere to the face a little bit more than a regular surgical mask. So those are your three options. N95 being the best, KN95 being the second best, slightly cheaper, typically $350 a mask, and then the regular surgical mask. And again, those regular surgical masks are really more so that you don't spread the virus to those people around you. It doesn't really protect you from acquiring the virus from somebody else.
And that's the same with the material masks. They really just are to protect you from giving that to somebody else. The other thing I want to mention about the mask, and I was discussing this with a patient yesterday, is I want you to think of this mask as a filter that is collecting and protecting you from the virus. So if you're touching this, then you're essentially putting virus on your hands. So once you have this mask on, when you go to take it off, you should first of all wash your hands, sterilize your hands, reach under the mask, pull it away from your face, and then again, when you put the mask down, clean your hands and sterilize your hands again. Think of this as being covered with virus in the front of it.
Yeah, I always give the analogy, it's like a landmine. Front towards enemy, right? So this side towards the enemy, and then the inside should always be kept as clean as possible. So the hand washing and good hygiene before and after you touch the mask, or you should never touch the mask. Before or after you put the mask on or off, it's very important that you practice good hand hygiene. So sterilizing, washing as much as you can.